SARS-CoV-2 virus. Firstly, SARS-CoV-2 is the name of the virus, which causes COVID-19 disease. The origins of this virus most likely began in the bat. Then, the virus likely jumped to pangolins, which later made a zoonotic jump to humans, which finally spread across the world due to human travel, physical contact, and touching objects that infected people also touched. Here I'll talk about COVID-19 and what does it mean to flatten the curve. We have heard this term in school, on the news, on Reddit, simulations, and even on Twitter, with the example of cats. Basically, the term to flatten the curve means to prioritize the healthcare system. If everyone does their part to reduce the number of new COVID-19 cases by limiting travel, not going in person to school or to mass or to concerts or to any events with more than 10 people, we can flatten the curve. On one side of the graph, we have time since first case, which we know began in January. On the other side, we have number of cases. By March 9th, the US had over 800 cases, and by March 19th, the US had over 14,000 cases. Over 10 days, that is more than a tenfold increase. If we do the math, we can also make predictions, starting with March 9th with 800 cases, which increased to 14,000 by March 19th. So by the end of March 2020, March 29th, we can predict there could be up to 300,000 cases, and by April 9th, there could be over 22 million cases. This number is a guess, given our growth rate doesn't change and nothing else changes. To give you an idea, 22 million cases is like 56% of California being infected, or 100% of 13 states across the United States being completely infected. That is 22 million. This guesstimate can come to life if we do not change our behaviors, if the state does nothing. Hearing other young people say, "I'm young, I'll be fine," or "no plan is the best plan," or "you're overreacting," or "I'll probably have it anyway," is exactly how COVID-19 cases will increase and come to overwhelm our healthcare system completely. For the sake of myself, yourself, and others, especially those who are high risk, which includes those with diabetes, asthma, or taking high blood pressure medication, if we do not follow ordinance like shelter-in-place and state lockdown orders, then the United States can become far worse than in Italy, where Italian residents and health workers alike are 10 days ahead of us and have continuously warned us to follow guidelines, practice social distancing, and not take any unnecessary risks. So yes, while you and I may be young, there is no guarantee we will be fine. We already have data surfacing telling us there is no guarantee. In the United States, 29% of severe cases have been those aged 20 to 40 years old. It is everybody's responsibility to practice prevention in order to protect those most vulnerable. It is important for everyone to not touch their face and know that you or anyone can be infectious for 3 to 14 days before getting any symptoms, which is why it is extremely important to stay away from others, 2 arms length, 6 feet. It is also important for anyone coughing to cover their mouth appropriately, since the virus can live suspended on particles in the air for up to 3 hours. From the New England Journal of Medicine, we also know that the virus can live on steel for 2 days and on glass and plastic for 3 days. So although we may be young, we must keep our distance from others. There is no need to hoard masks. Clinics and hospitals need them now more than ever, so if you have extras, please donate them. Everyone anywhere should be able to test immediately, for free, regardless of health insurance, and know the results using point-of-care tests. But these type of tests and others have yet to become widely available. The US is testing. They've tested 250,000 patients so far, but hospitals and doctors are approaching capacity, and many states don't even have enough tests to test for mild cases. Until then, high-risk individuals are likely to get priority. Also know that even after recovery, one is still infectious for up to 3 weeks, which is why we must all practice social distancing and stay home as much as possible for the coming months. Only leave to get your medication and food. Any type of soap is effective at penetrating the virus, just as you make sure to regularly and thoroughly wash your hands for at least 20 seconds. Wash your thumbs, wrist, under the nails, on the palm of your hands, and on the back of your hands and even elbows. Leave jackets, shoes, bags, and purses near the door, and be careful not to fall for rumors and scams in the coming weeks. Check the sources and never take anyone's word for it. Don't even take my word for it. Look up the facts and numbers yourselves. Use reliable sites like the World Health Organization WHO, university articles and videos like UCSF and Caltech.edu. Use data visualization maps like coronavirus.1.3 acres or the raw data itself from the CDC. Evidence is vital. When ordering food online or buying anything from the store, be sure to disinfect the package with diluted Clorox, bleach, soap and water, or 70% alcohol spray. And if you can disinfect the package, like a box of eggs or a bag of cookies, then discard the package and put the food inside clean plates, bowls, and containers. Returning to the question, what does it mean to flatten the curve? It means that we are able to prevent death and suffering. Without a vaccine, widely available tests, or safe treatments, the growth rate of new cases depends on all of us. By following the guidelines from nurses, doctors, and researchers, and making these guidelines second nature habits for the coming weeks and possibly even coming months, then and only then can we reduce the growth rate and in turn flatten the curve. But it's not the only benefit. By staying home and avoiding gatherings, we can also give the healthcare system crucial time to increase their equipment, beds, ventilators, and supplies, thus increasing the threshold. In addition to increasing the time between cases, this means that doctors and nurses can work on critical cases with more time and energy over a longer period of time. This can be done by aggressive actions like the California lockdown on schools and work and public gatherings and the shelter-in-place ordinance. We can also help decrease the time frame of a disease by giving research centers time to develop treatments and safe drugs. On a final note, I'd like to talk about the side effect of the virus, which is the racism and violence it's produced against our Asian community members, peers, co-workers, storekeepers, nurses, and doctors domestically here in the United States and abroad. I am here to say the virus is not an excuse or justification for racism or violence. Together, you and I can reduce death and suffering, protect those at high risk, and help our nurses, doctors, and researchers until a vaccine is developed.